Hi everyone, our topic is English language teaching in the post-method era, toward better diagnosis, treatment, and assessment. Consider this video as a trailer of the lesson. There was search between 1880 and 1980. What kind of a search was it, Willy?
It was about method. Experts tried to find the best method for language teaching. Let's remember what experts said. According to Edward Anthony, approach, a set of assumptions dealing with the nature of language, learning, and teaching. Method, an overall plan for systematic presentation of language based on a selected approach. Technique, specific classroom activities consist with a method and therefore in a harmony with the approach as well.
But Richards and Rogers disagreed with that idea. According to them, method was an umbrella term to capture redefined approach, design, and procedures. Experts applied following methods. Firstly, the audiolingual method in the late 1940s. Secondly, cognitive code learning method in the early 1960s. And then community language learning, the silent way, suggestipedia, total physical resonance, and the others. Why these methods failed? Because the methods were very too prescriptive, too narrow, and experts' attitudes towards methods was wrong. They were too scientific.
So what principle makes a method a method? First one is automaticity. Do not think too much. Language forms should come to mind automatically. Second one is meaningful learning. Learn what you will use in the real life. And third one is reward. Reward your learners. That's a gift for your brain. Fourth one is instinct motivation. Learners should be eager to learn. Fifth one, strategic investment. To be a master, there should be an investment in effort, time, and attention. Sixth one is language ego. Learning a second language gives a new identity to the learner.
Seventh one is self-confidence. Learning a second language builds self-esteem in the learners. Eighth one, the risk-taking. Successful language learners must be willing to take risks. 9, the language culture. Whenever you teach a language, you also teach a complex system of cultural customs, values, and ways of thinking, feeling, and acting. 10, native language effect. The closer the first to the target language, the more effective acquisition will be. 11, interlanguage. Teacher should help learners to develop their own language. 12, communicative competence. Actually, communicative competence is the main goal in methods.
So what is diagnosis? We need to diagnose like a doctor. We should take into account our learners' needs first. Whether the curriculum suits the learners or not is an important issue as well.
Treatment. During the treatment, take these into account. 1. Lower emotions. 2. Encourage risk-taking. 3. Build students' self-confidence. 4. Help students develop intrinsic motivation. 5. Promote cooperative learning. 6. Encourage students to use right brain processing. 7. Promote ambiguity tolerance. 8. Help students use their intuition. 9. Get students to make their mistakes work for them. 10. Get students to set their own goals.
And the last step is assessment. Assessment should be with harmony with the method you use. Choose formative or summative type according to your needs. Try to avoid washback effect. And that's all. Thanks for listening.